Because future-looking statements are inherently subject to risk and uncertainty, our reminder is that you should make any purchasing decisions or investment decisions based on products that are currently commercially available.
Welcome. I'm Kristen Thorne, and I lead Accenture's public health industry practice. I'm thrilled to join you today, along with Yusuf Tayob and Bill Patterson, to talk about vaccine management, including what we're seeing in the market and the complexities of what will be required for states to be successful, and what we consider to be the 4 must-dos to get this right. And getting it right isn't just an opportunity, it's an imperative. And at the heart of this challenge here in the U.S. are underfunded public health departments, which do mostly underappreciated work, and for generations they have vaccinated Americans against the toughest of diseases: polio, measles, smallpox, hepatitis, meningitis, the flu, and hopefully, very soon, COVID-19. But unlike most other mass vaccination campaigns throughout our history, the vaccine for COVID-19 will be administered during a time of epic political, economic, and social turmoil. We have lived through so much this year, and we simply can't afford to mismanage or inequitably distribute life-saving doses of a vaccine that promise not just to prevent a disease, but also to return some sense of stability and normalcy to communities around the world. But the task before us hasn't been done in recent history. Vaccinating an already wary population in the right places at the right time, and for certain vaccines, even making sure both required doses are administered within a 21-day time frame, speaks only to the social challenge and says nothing of the technical hurdles of maintaining super strict cold storage across what will need to be a highly secure supply chain. Beyond that, we have to convince 70% or more of the population to be vaccinated so that we may have a sufficient level of immunity when many people today are skeptical of the vaccine's safety. Outside of the U.S., many countries have joined COVAX, the vaccine pillar of the access to COVID-19 tools, or what is referred to as the ACT Accelerator. This consortium of countries has come together by the World Health Organization, the Global Alliance for Vaccines, and others to accelerate the search for an effective vaccine and to guarantee fair, equitable access to vaccines for every country in the world. Here in the U.S., we're relying largely on our states, and as with COVID-19 testing and tracing, each state will approach this challenge a little differently. Whether a path a state chooses, or a city or a county, we're encouraging leaders to focus on 4 must-dos. First, put together a detailed supply chain model to forecast supply and demand. Make sure it is sophisticated enough to handle all the distribution and visibility needs of your state or community. The second is to develop unambiguous distribution guidelines and procedures so that the phased rollout will be equitable, orderly, and easily understood by everyone, from those administering the vaccine to those receiving it, to other local leaders, and the media. Our third must-do is that at all times, communications must be open and transparent with all residents. Design a community engagement plan down to the zip code level and be forthcoming about who is eligible to receive the vaccine, when and how they can do so, and how the vaccination plan is going. People will give us space and grace to make mistakes and understand that flexibility may be required to navigate changing circumstances, but only when communications with our residents are straightforward and clear. And our fourth and final must-do is to aggressively use CARES Act monies to fashion and disseminate the plan. You can have a best-in-class immunization distribution and tracking system, but if you don't have a healthy supply chain model and communications approach, you are missing the foundation of how this will succeed. Making all of this happen requires an orchestration of expertise and technologies spanning public health, public sector, life sciences, supply chain, and marketing and communications. To say we are in uncharted territory is cliche, but that makes it no less true. I'm going to hand it over to Yusuf Tayob, our global lead for the Accenture Salesforce Business Group, to share how we can create the roadmap for making this happen.
Thanks, Kristen. When we all came into 2020, we certainly did not expect this is what we would be planning for by the end of the year. But it's so important to understand how governments and businesses should be addressing the challenges and complexities of this critical effort. Hello, everyone. I'm Yusuf Tayab, and I lead the Accenture Salesforce business group globally. I'm responsible for helping our clients address their organizational opportunities and challenges using Accenture expertise and Salesforce solutions. We've been collaborating closely with Salesforce on vaccine management, and I want to thank you all for the opportunity to share our point of view on how to build and execute a comprehensive plan to bring COVID-19 vaccines to your community. For those of you in the public sector, or those of you who are tracking the vaccine distribution process closely, you will appreciate that our solutions are in support of where the CDC has been guiding focus: policy, scalability, collaboration, and funding. In order to address these requirements, we've developed an overall solution set that can be deployed through a modular approach. Today, I'll give you a short preview of each, and I or my team would be happy to connect with you at any time to talk in more detail. Our first module is a vaccine management and tracking platform, as you can see on the slide I'm sharing with you now. This capability expands on Accenture's contact tracing capability, which was built on Salesforce's Work.com product. And the platform is designed to securely track a person's vaccination journey from registration and appointment scheduling to vaccine administration and symptom follow-ups. This is where we create the recipient's vaccine experience from start to finish. The second pillar of the solution is supply management. And in this constantly changing environment, we know we will have to be flexible and agile, sometimes needing to move supply from one provider to another provider, depending on scheduling and demand. Here we draw on proprietary models and Accenture's extensive supply chain experience to support vaccine supply ordering, inventory management, and demand forecasting. The third pillar speaks to community education and engagement. This module leverages Accenture's marketing and campaign management capabilities and Salesforce's Marketing Cloud to help drive awareness and adoption amongst providers and patients. I think getting the communication piece right is probably the most important element of a vaccine management program. As Kristen mentioned earlier, communicating openly and transparently with all citizens is a must-do. In addition to education materials, this module also includes eligibility tools and a vaccine finder. The fourth pillar is focused on contact management. Also built on the Salesforce platform, this solution is designed to help with large increases or surges in call volumes by deploying virtual agents to address frequently asked questions. We've built automated text and email capability for community engagement, eligibility screening, and health surveys. And there are also virtual assistant capabilities that allow organizations to provide 24/7 support for residents that can be deployed at low cost to the providers. The fifth and final pillar is specific to analytics and reporting. And here we use Accenture's analytics capabilities to curate public health and third-party data and create equitable vaccine distribution plans, address high-priority populations, manage vaccine supply, drive population engagement, and dosage regimen adherence, and of course to provide last-mile distribution logistics analytics. I'm going to hand off to Bill Patterson now. Bill is Salesforce's EVP and GM of CRM applications, and he'll share more on how organizations can leverage technology to navigate these pillars.
Thanks, Yusuf. COVID-19 puts new management and scale demands on our existing vaccine delivery systems like never before. At Salesforce, we introduced Work.com to meet the ever-changing needs of this pandemic. We offer the technology and tools that not only has helped workplaces reopen and support employees and customers alike, but now we're also helping to protect our communities. As we prepare now for one of the largest vaccine administration campaigns ever seen, we've now introduced Work.com for Vaccines to help with all the critical steps that Yusuf just laid out. Work.com for Vaccines supports inventory management, patient scheduling, clinical vaccine administration, vaccine outcome monitoring, as well as public health notifications, and it does so at scale. What does this all really mean? Well, from knowing where our vaccines are, how much is in each location, to finding new ways to schedule vaccinations quickly and efficiently without overcrowding our health clinics, there's a lot of information that we need to manage this successful vaccination campaign wave. What's more is that patients and citizens need simple tools to schedule vaccinations or to provide their health history to determine their eligibility. All of this is made possible for organizations to quickly find ways to train their vaccine administration professionals, track health outcomes, and to understand how to respond to community-wide vaccine results. Let's take a look now at this technology in action. Here we are through the lens of an individual, Mr. Jones, who wants to get vaccinated. He finds his local county website and reaches out to set an appointment. Mr. Jones uses his local provider's online portal to find clinics and vaccines in stock, finding a time and place that works with his schedule. Now the health provider needs to assess that they have adequate inventory to administer the vaccine for Mr. Jones. As more requests like his come in, do they have enough inventory to support the forecasted demand? Once the provider confirms there's enough vaccine for Mr. Jones, they need to understand his current health history. How do his age and other health conditions affect the safety of him coming in and getting a vaccine? As he arrives for his appointment, clinical staff can assess his health record, which may include a full 360-degree view of his health immunization history, as well as other information that might help him take this vaccine safely and securely. When administering Mr. Jones's vaccine, his provider can now capture that he was vaccinated, on which date, what vaccine he received, the lot number, the manufacturer, to really help monitor successful outcomes. After his first appointment, the provider may also need to reach out to Mr. Jones in the next 30 to 45 days to schedule an appointment to administer the second dose and integrate this vaccine update into his medical records. Finally, Mr. Jones' health provider can track the progress of all his vaccination programs in a central location thanks to the power of Tableau, taking action on things like reported health concerns, supplier availability, as well as ensure other vaccine preparedness. When you multiply this one scenario by hundreds of thousands, millions of people like Mr. Jones, it's clear why the 5 pillars that Yusuf just laid out are so critical. This is why we've extended the value of our technology to partner with organizations like Accenture, allowing everyone to leverage Salesforce's flexible, agile technology platform at scale, as well as Accenture's expertise to deploy successful vaccination campaigns, because this is how we're going to get through this incredible pandemic together.
Thanks, Bill. That is a great view into the platform and work.com for vaccines. It really brings it to life. Wrapping up, I want to leave you all with 3 key takeaways for today. First of all, we've learned a lot about disease surveillance in 2020. We know that policy, education, communication, and patient experience are all going to be important to get the majority of the population vaccinated. Second, we know that being able to take a modular and iterative approach with the technology platform is critical, and having a scalable solution built on Salesforce ensures that you can be agile in a rapidly changing environment. With contact tracing, for example, we were able to bring several states live in just less than 2 weeks, and then continue to improve and enhance processes and technology in real time. Third, the vaccine landscape is changing daily, and we're all going to have to work together in the coming months. If you would like to talk more with Accenture or Salesforce, we'd welcome the opportunity to design your approach together. Thank you for joining today. Be safe, and here's to a healthy 2021.
Fly away fly away to the end of time. Fly away with me. I search the world for you. I will climb those mountains for you. I will sail the seas just to be with you. Fly away with me. Fly away with me. I will fly away to the end of time. Fly away. I'm changed because of you. You're the wind that carries me through. You have given me hope when I needed it most, and yet you still love me. Fly away with me. Fly away with me. I will fly away to the end of time. Fly away with me. Fly away with me. Fly away with me. I will fly away to the end of time. Fly away with me. I will fly away to the end of time. Fly away with me. I will fly away to the end of time. Fly away with me. My grandfather, he was a kind man. He lived on homestead land. Sometimes it seems me the songs he wrote when he was just a young man, and he played me a real old style. Play me a real old style. My auntie, they all love to dance. The families love to sing. I sing with them when I get the chance. Sing the songs they sung to me, and he played me a real old style. And he played me a real old style. But these folks, they were young no more. They will pass away, and I know that I'll remember them, the songs they used to play. And they played me a real old style. a real old star. Kumagagay kinaya iinabe kapapalo imay kaunawikili. Kumagagay kinaya iinabe kapapalo imay kaunawikili. Kailan may awit manu hamalame nilaet niyo. Kailan may awit manu hamalame nilaet niyo. Haolendo hauelo amai Iugivaya okekuaini. Haolendo hauelo amai Iugivaya okekuaini. Nakamukua Leia ina kekupuna. Heiva iva nakamukua Leia ina kekupuna. Mapuna ke Leia mai Oi kawai lele, oi ilawe. Haina iamay ang nakapuana. Kumagagay kinaya iilawe. Haina iamay ang nakapuana. Kumagagay kinaya iilawe.